Hello and welcome back to the cardiac trials portion of the show, where today we're going to discuss the Prodigy trial. And what the Prodigy trial is it's a randomized control trial that looked into the optimal duration of antiplatelet therapy after cardiac stent placement. Now, the way I learned it just a few years ago was that you should give dual antiplatelet therapy for a minimum of 1 month after bare metal stent and a minimum of 1 year after drug-eluting stenting. And then you stop the clopidogrel, but you continue aspirin lifelong. So perhaps that's how some of you have learned it also. However, what the literature tells us is that it's just not that simple, and that we're still faced with unresolved issues. One is with regard to the duration of dual antiplatelet therapy, and the other is with regard to the whole issue of clopidogrel non-responsiveness, or reduced responsiveness, as I tend to think about it. Remember, clopidogrel is a prodrug that's metabolized by the CYP2C19 pathway in the liver, and this can work very differently in different people. Now, the Prodigy trial addresses the former issue of how long we should use dual antiplatelet therapy after cardiac stenting. It does not address clopidogrel pharmacogenetics. And the reason I like to discuss Prodigy is because amidst these unresolved issues, I think this trial does provide us with some useful evidence that can help in our management of these patients. So here it is, Prodigy. This manuscript was published in Circulation in March of 2012. Prodigy, of course, is an acronym, and that stands for Prolonging Dual Antiplatelet Therapy Treatment After Grading Stent-Induced Intimal Hyperplasia. This is the cover page, and now here come the authors. First author is Marco Valgamigli. I hope I said that right. And this tells us that Prodigy was a multi-center randomized trial. And here we go. Let's go to the conclusion as it's written in the abstract. 24 months of clopidogrel therapy in patients who had received a balanced mixture of drug-eluting or bare metal stents was not significantly more effective than a 6-month clopidogrel regimen in reducing the composite of death, MI, or CVA. Now let's break down the Prodigy trial. So again, optimal duration of dual antiplatelet therapy after stenting. 6 months of dual antiplatelet therapy versus 2 years of dual antiplatelet therapy. And the primary outcome is a composite of death, non-fatal MI, and stroke. So people were also randomized to one of 3 different types of drug-eluting stents or one type of bare metal stent. So that's interesting, right? So you have a 1 in 4 chance of getting a bare metal stent if you're in this trial. So 1,970 patients were included, randomized at 30 days after the stent was placed, and the trial included both ACS and non-ACS patients. And here is the actual study profile. Again, patients randomized to 4 different types of stents, and you see that in the red boxes, and then randomized to either 24 months of dual antiplatelet therapy or 6 months of dual antiplatelet therapy that's shown in the green boxes. Now notice, they don't exclude many patients. So if you had an event before randomization at 30 days and after PCI, you're still in the study. And this is one criticism actually of the study. People felt they should have excluded those patients. So baseline characteristics regarding ACS status, and this is what I am most interested in with regard to Table 1. I want to know whether these are stable CAD patients or STEMI patients, etc. And here you can see that 75% of patients had ACS and 25% had stable CAD. And look at this, 33% had STEMIs. So this is good to know. These are pretty sick patients. And Prodigy, they didn't exclude many. And here you can see the actual list. Exclusion criteria: you were excluded if number 1, you had an allergy to aspirin or clopidogrel; number 2, a planned surgery in the next 24 months; number 3, major surgery within 15 days; number 4, a history of bleeding, diathesis; number 5, previous stroke in the past 6 months; and number 6, if you were already on oral anticoagulation. And here are the results from Prodigy. At 2 years, they looked at the outcomes. So the primary outcome was a composite of death, MI, and stroke. This occurred in 10% of the patients who had 6 months of dual antiplatelet therapy and in 10.1% of patients that received 24 months of dual antiplatelet therapy. No significant difference. And look at death, 6.6% in either group at 2 years. Wow, so to me that seems low. So 1 in 15 people are dead at 2 years. And they included almost everybody in this trial. So remember, a third of the patients had STEMIs at baseline. And remember, they were included. So again, the bottom line, however, is that 2 years of dual antiplatelet therapy is not better than just 6 months of dual antiplatelet therapy. In fact, what you'll see on this next slide is that bleeding was actually higher in the group that got dual antiplatelet therapy for 2 years. So twice as high in the 2-year group, regardless of how that was measured. So they measured this by BARC 2, 3, or 5. That was twice as high in the 24-month group. TIMI major bleeding was twice as high in the 24-month group. And red blood cell transfusions, twice as high in the 2-year dual antiplatelet therapy group. So that was Prodigy. Now let's turn to the